Welcome back, everybody. Another beautiful sunny day, 90 degrees in Northern California. It is Wednesday, October 14th. I'm back with Gary Green with some more COVID issues today. I do want to say, Gary, thanks very much for your time for these meetings as well as the work you do. I don't know if you all realize, but Gary essentially consults on every COVID patient in the hospital, so he really is our authority on that. So, Gary, let me kick it off with a real general question. So what is the state of the infection across the world? Where are we at in the picture right now?
So it's nice to be here. It's good to work with the group. I really like this group. Happy to chat with you guys about where the virus stands. So it's in different places in different parts of the world. You know, right now the world stands, I have a couple numbers here, at 38 million confirmed cases in the world. In parts of the world like the UK, Spain, and Italy, and I'm going to show you a slide right now. This slide demonstrates that it's bimodal. You see one arrow where to the left where it was their first wave, and now UK is in the second wave. That goes for the same for India, Spain, France, the UK. So there's been a number of new cases in Italy, and they're making changes with their public health recommendations. Now, how do we stand in the US? This is the second slide I want to show you. The second slide shows you kind of where we are in the US. And in the US, we're still in our first wave. So we, across the nation, have not really improved overall very much in that first wave. So we just can't really lock it down. What's interesting about the United States is that although the first wave was in late July and early August, New York had it early, the West Coast had it next, Arizona had it next, now it's hitting the Midwest. So right now the Midwest is going into the first wave. I'm going to show you one more slide on epidemiology. This is a Sutter slide. And this slide shows you that in the Sutter footprint, including in our county, that our numbers are down. So to the right is kind of where we are currently, and we're at the bottom of our first wave. We haven't seen the second wave yet in California or in Sonoma County. And so I think we're doing really well. Our health officer is really being stringent about what we're doing in the county, and I think that that's a good news. It makes it hard for businesses, makes it hard for kids, makes it hard for a lot of us parents, but I think that's helping with the pandemic to lower our numbers so far. We're still seeing new cases, Gary. Yeah. You know, I had a fatality last weekend and 3 new cases Monday night. So we're still seeing new cases in the hospital and in the respiratory care clinic.
Gary, you talk about a second wave as if it's a given, it's going to happen. Is that kind of how these things work, or is there a possibility we won't have a second wave?
No, we'll probably have a second and maybe a third wave.
Okay.
And we kind of model that after other pandemics, including the 1918 pandemic, where we had 3 waves in 1 year. Now that virus had a little different of a reproductive number, which is an epidemiologic tool, but we expect at least 2, probably 3 waves. But in some countries where you don't really lock it down, you may have one wave overlap onto another.
So, you know, when this all started, we thought we'll stick it out. It's a brief sprint. Clearly, this is here to stay for the foreseeable future. I used to quote these numbers that, hey, it's been 4 months now, we haven't had any infections, it's been 5 months. Well, folks, we're now 7 months into this, and we have over 500 staff, providers, employees, and we've not had an infection from being at work here. But it's just a matter of time. So we're going to stop saying that, because you and I all know it's just a matter of time before one of us gets infected. This is our new normal. So things are changing. Tell me, you know, it seems like our new normal is, how do we live with this virus? So we're having to modify our procedures and policies to this new realm. What do you say about that?
So I think you're right. I think we're all being exposed to this virus all the time. And it feels sometimes inevitable that if you're not really careful, you're going to be exposed to someone. Most of those exposures are happening in the home. And so whenever there's mixing, like a barbecue, like a wedding, when there's mixing with a dinner party, or maybe a daycare setting, or for some people who have to go to work, in other areas besides healthcare where they're not taking the same stringent precautions, there's going to be other infections. So in our work setting, I'm very optimistic that we've been doing things really right, and if people still check at the door, wear a mask, wash your hands, keep that social distancing and that physical distancing of 6 feet, I'm very optimistic that our clinics and our hospital will maintain its safety. We know that when one of our neighboring hospitals had an outbreak, that was where people driving into work together, they were carpooling without a mask. So that brings us to close contacts. The CDC has clear guidelines on what is a close contact. A close contact is someone who's not wearing PPE, you're exposed to an infected person, you're within 6 feet for more than 15 minutes. That's a close contact. If you're within 6 feet of someone who's got this virus, asymptomatic or symptomatic, but you're wearing a mask, then you're more protected. If the infected person, asymptomatic or symptomatic, is wearing a mask, then you're protected. And so that wouldn't be considered a high-risk close contact. So what we're developing, and this is going right now through leadership, as you know, we're developing something we're calling a close contact procedure. This is the last slide I'm going to show you, and I'm going to go over this in a little bit of detail. I'm going to give you 3 scenarios on this. The last one's important. The first scenario is symptomatic healthcare workers. So if you come to work sick because you're exposed at home, for example, you would go to the respiratory care clinic for testing, and you'd call your manager, or I would call Peter as a medical staff person, and tell him before coming to work that I have symptoms. And we make sure you get tested. So people with symptoms shouldn't come to work. But what if you're asymptomatic and you've not had a known contact? Like we all do, you wear a mask, we do temperature screening at the door, symptomatic screening at the door, and you come to work. And that's normal. The third scenario is one that's going to be more prevalent as we go through wave 1 and wave 2 and potentially wave 3 of the virus. The third scenario is you're asymptomatic, you're a healthcare provider, you've had close contact with someone. What do? We follow CDC guidelines. We define the close contact if you've been within someone for more than 15 minutes within 6 feet. So you've been having dinner with someone at the house. You've been sleeping with your spouse who, that happens over 15 minutes. Or let's say you went to a dinner party, or you drove in a car with someone from here to San Francisco, and you're in the car for more than 15 minutes, more than 6 feet, and no one's wearing a mask. In those close contacts, what we're going to do is, again, you have no symptoms, so you're wearing a mask already, you're getting your temperature checked at the door, and you're coming to work. So if you are asymptomatic with a known close contact, even at home, you can still come to work if you don't have symptoms. Now, the difference is the policy is going to state that contact your healthcare provider and get tested. So our testing capacity is about to change. We're actually getting an Abbott machine in the respiratory care clinic. We've been asking for this for months. So we're going to have a rapid test with the Abbott Now machine. We call that point-of-care testing in the respiratory clinic. So when you call your primary care doc and you're asymptomatic with a close contact, we'll have you tested in the respiratory care clinic, and you're going to know within 15 minutes to 60 minutes what your test results are. If your test results are negative, you come back to work. And then what we like to do is repeat that testing. We're going to test it at day 1 and test it at day 10. And this will be a standard procedure or a standard procedure policy that we'll be rolling out as soon as we get the Abbott machine, and probably within a week or 2. I think this is going to be very helpful, because if you're asymptomatic and you have a close contact at home and you're testing negative, as long as you don't have symptoms, you can come to work. So what do your colleagues need to do? If you're a contact of a contact, you don't need to be tested. If you're a contact of a contact, you're wearing a mask. If you're an asymptomatic contact of someone, you're still wearing a mask. If someone were to be in the incubation period and they were to come to work with asymptomatic infection and you're wearing a mask and you're keeping care of social distancing, the risk is really negligible. So this policy is going to maintain just as safe of a place as we had during this whole pandemic. And I think it's going to clarify a lot of issues. Now I want to thank Sean Franklin and also Faraz Schillinger for getting the Abbott test. So this point-of-care testing is going to be very helpful, and we're going to embed it in such a way that it'll be useful for our staff in keeping providers safe.
Wow, good, thank you. Another slightly different topic. As more and more people become infected, and the numbers you quoted are astronomical, we start getting some new topics to come up. So an example, recently there was a close garden party surrounded by roses. Some very, very famous people became infected, and some of them are saying they're immune now. But tell me what's the data say about immunity after infection versus reinfection? Is there any? We've been into 7 months. Is there any data on that now?
So the good thing is with cohorts and more studying, we're understanding better and better, and we're seeing reproduction of good data. So we know that when someone gets infected and you get hospitalized, about 5 to 6% of people might not develop an immune response, or I should say they don't develop an antibody response.
Okay.
So we measure the antibody response as immune response. There could be a T cell response, but we can't measure that. So 5 to 6% of people don't get an antibody response. And those are real hospitalized patients, and that's a good study out of Asia. What we also know is if everyone is symptomatic, let's say a cohort of people are all symptomatic, about 18%, and it's about that number, 18% are going to go on to have asymptomatic infection, never develop symptoms, and they're going to get rid of the virus much more quickly. The real new thing, and there's been a couple published studies about this, what about reinfection? Can you get the virus once and get it again? There's been a couple cases, less than 10 in the literature, scattered throughout the world. I think like the Netherlands was one, the US and Nevada was another, Belgium and Ecuador. There have been a couple cases, less than 10 in the literature, of potentially reinfection. What does that mean? We have 38 million cases in the world. Of 38 million cases, a handful are going to have rare findings, and we could expect that from a pandemic. We're going to have some rare, unique things happening, but they're not going to be very common. So reinfection is very rare, and developing an immune response is very common. I'll give you some good news. Vaccine is going to give you probably 4 times the antibody response to natural infection. So vaccine is going to be very helpful for this virus, because the response you get from the vaccine so far in preliminary studies is better than the natural infection, and we didn't expect that good news.
Okay, so the natural infection has a very low rate of reinfection. The vaccine is going to be even more protective.
Correct.
Okay. Let me finish up with just a quick comment. You had mentioned there's some good news. You have anything positive to report? There must be stuff coming out all the time.
Well, there's always stuff coming out with vaccines, but a new study came out about pregnancy. Okay. So if a mother is pregnant and she gets coronavirus, we know that that's not a huge red flag like it was in 2009, H1N1. In 2009, with that mild flu, pregnancy was a big deal. Well, now we know that pregnancy doesn't really carry a significant risk like diabetes does, for example, with this virus. But if a pregnant woman does great with her coronavirus, but at the end of her pregnancy she delivers to a child, can she pass it on to the child? A really good study in New York City showed that less than 2% of mothers pass this on to the child as an infant, and of the children that got it, the 2 out of 100 children that got it, none of them had symptoms.
Okay.
So now the recommendations are, for a pregnant woman, you can take care of your child, just wash your hands, wear a mask, and you can breastfeed as well. So that's good information, because a lot of pregnant women are, I think, understandably nervous about this.
Yeah, that's good. Well, wow, that's a lot of information to digest. We appreciate you coming. I'm going to close with a few quick announcements. One, germane to the group. The Smugger Board of Directors has 2 seats that are up for re-election at our annual shareholders meeting in November. Nominations should be into Erica McGuire, myself, and Peter by the end of Friday this week. So please get those in. Number 2, we have some events coming up. Specifically tomorrow we have the Great Shakeout, which is a California-wide event. It's basically an earthquake practice maneuver, 10:15 a.m. tomorrow. It's really an opportunity for all of us to develop and practice our standard work of how we respond to an earthquake. So people are supposed to respond by dropping and covering. If you are in practice, if you're in clinical moment seeing patients, you can ignore it. But for the rest of us, that's our practice tomorrow. And then lastly is kind of the final advertisement for our Smugger event this Saturday night, our drive-in movie, Hocus Pocus. So food will be included at 6:30 Saturday night in the parking lot at Cardinal Newman High School. There's still some room available. So please RSVP so we can have enough popcorn for you. Get back to Cecilia Fuentes or Peter or myself, and we'll all have a great time. So thanks for hanging in there with us. Stay safe.
Thank you.